with us Dr. Anshul Goyal, a critical care specialist in SSD Hospital, Faridabad. We welcome you to Natco Pharma Specialty Criticon 2024 studio. What we look forward to hearing from you is the advice to the younger generation of doctors in the space of critical care associated with antibacterial resistance.
Critical care is a very vast field. It is very emerging field. In outside world, so many people will not appreciate you matlab, as a good doctor, critical care specialist, especially. And but you are the best in whatever you are doing for the patient, for the things, and we have to be take care of about the antibiotic resistance also, because these days uh, some doctors they are using antibiotics left and right, who are practicing outside, they are using left antibiotics. They are using higher antibiotics which are not sometimes not indicated in the patient. So in that patients, we have to be very limited. We have to use. We have to see whether we want to use. We have to give the antibiotic or not. Whether this patient requires it or not. First of all, we see the things. If at all patient comes with a septic shock, give antibiotic. Then it's not like if you started the antibiotic, it is going on. Once you have the cultures, you have to de-escalate the antibiotic, you have to decrease the dose and everything, de-escalation. These policies are should be there. So everybody should keep in the mind. We should remind all these things to limit the antibiotic resistance.
So, what are some of the challenges you foresee in the critical care management?
Challenges like people, they some people they have a prefixed thought that no, I want to give this dose only, I want to give this medicines only. These are the challenges. Otherwise, there are so many challenges, but this challenge is maximum. Some people they want to fix their antibiotic. We want to give this antibiotic only. So in that case, we have to be little bit more aggressive. No, we don't want to give this. We have a culture report. We have, if we want to start empirical. Why we are starting empirical? We have to give the reasons also.
What is your advice to the younger generation of ICU doctors and how they can enhance patient care?
For patient care means the key of the management is just keep reading and keep utilizing, know your hospital antibiotic policies, know your antibiogram, know your bacteria. You have to know your bacteria first. It's not like this medicine we are giving, and you have to keep reading, you have to keep updating yourself. That is it.
My third question and the last question is what is the prevalence of carbapenemus producing bacteria in your practice, and what do you think is the best treatment option?
But carbon resistance is quite very high. I will not say less, or it's quite very high in my practice, because patient will come from here and there, they'll come on the meropenem and they'll come on the higher antibiotics. People are taking meropenem at home also. So those people, and which are not indicated sometimes. So carbon resistance is very high, and treatment options are so much. Like you can use ceftazidime for resistance. You can use polymyxins. We have so many options. Really.
Great. Dr. Goyal, we thank you for your time here at the Natco Pharma Specialty Studio, and we wish you all the best in your practice.